thank you so much for joining. Welcome to the COVID-19 Vaccine Forum. I am Lindsay Harris. I'm the president of the Alabama State Nurses Association and proud member of New Life Interfaith Ministry. And I would like to thank those who have made this event possible. I'll first give our pastor, Senior Pastor George Matthews II, pastor of New Life Interfaith Ministry and Calvary Resurrection Church, an opportunity to speak.
Thank you, Lindsay. As I've endeavored to say to the team, the medical team, along with our council persons, we feel, Pastor Jay and myself, feel almost indebted to you all for the information and the gathering of your time together to make our community as informed as we possibly can on this all-important issue surrounding COVID-19. I just have to say to you how much and how valuable we feel it is that you all have collected yourselves together to bring this information as a service to our community. So thank you to all of you, to President Donald. We appreciate you, District 3, to District Council Person Kim Alexander. Thank you to each of our gifted and talented physicians. I can't tell you how grateful I am and how privileged I feel to be a part of this endeavor to bring to our community information that I believe will be transgenerational. Because if we can save lives today, we are saving lives tomorrow, and tomorrow's tomorrow, and even thereafter. So thank you. As a collective, we appreciate you all. And remember, you're invited to both of our campuses as well, New Life Interfaith Ministries, as well as Calvary Resurrection Christian Church. So thank you, and 1,000 times over, thank you.
Thank you so much, Pastor Matthews. I would now like to give President Donald an opportunity, president of the Bessemer City Council and the counselor for District 3. President Donald.
Well, good afternoon, all. And thank you, Lindsay, and thank you, Pastor Matthews and the New Life family for the national, the state, and the local Black Nurses Association for giving Bessemer City Council the opportunity to collaborate with you, and also Dr. Kennedy from the University of Alabama at Birmingham. I pray that this will not be the last forum that Bessemer and the Black Nurses Association will host together, but we can't thank you all enough for involving the council and the community on this great panel of educators. Again, thank you.
Thank you, President Donald. I'd also like to give Councilor Kimberly Alexander, who is the council person over District 2.
Hello, everyone, and thank you all. Thank you, Ms. Harris. I've seen the great work you have done. Dr. Kennedy, I watch you as I'm on the road all the time. Thank you, Dr. Dawson. Pastor Matthews, thank you so much for having us to be a part of it. I don't know if y'all know, but I'm a nurse and I worked at the epicenter of COVID. I went to New York. I went to every hotspot. So, I mean, this is so dear to my heart. And I thank you so much because we need to get this information out in our community to our people. Thank you again.
Thank you, Councilor Alexander. So I would once again like to thank everyone who has partnered together to make this event happen. So without further ado, I'll briefly introduce our two illustrious speakers or panel today. First, we have Dr. Kirsten Kennedy, and she is the chief of UAB Hospital Medicine. And then we also have Dr. Martha Dawson, who is the president of the National Black Nurses Association. So thank you both. So we'll go ahead and get started because I know that you all have many questions, and I would urge you to filter your questions through our Facebook as well as our YouTube platform, and we will definitely get to your questions. So our first question is for Dr. Kennedy. Dr. Kennedy, can you briefly talk to us about COVID-19 and discuss some of the vaccines that are available?
Absolutely. So I guess we'll start just with a good foundation for everybody, right? So COVID-19 in and of itself is the respiratory illness that the coronavirus causes. So the actual name of this virus is called SARS-CoV-2. It stands for Severe Acute Respiratory Syndrome, SARS, and CoV-2 is an abbreviation for coronavirus. Now, we call it the novel coronavirus because coronavirus in and of itself is not new to us. Coronavirus causes multiple illnesses that we already know. Number one, the most common is the common cold. Oftentimes, if you get a cold, it is caused by a coronavirus. If you remember SARS, SARS, or MERS, over in Asian countries in the early 2000s, it's the same type of virus. This one is just modified somehow. And however it has changed, it has made it novel. It has made it something that is more easily spread and that is actually more severe. So what we know about this illness is that it can vary in how it impacts people. For some people, they have no symptoms. Some people get kind of like a common cold, right? You'll hear that from folks. And for other people, it can be catastrophic. It can cause multi-organ failure. The first organ that typically fails is the lungs, requiring intubation and needing to be on a breathing machine. And, it can make you septic and just very, very sick, and people die from it. We don't know exactly how it's going to impact people. We haven't quite figured out what it is about a person that allows them to either fight it off and have little to no symptoms, or someone that is going to get really, really sick. And that's what I think makes this illness so scary, is that we don't know who to shelter, who to protect, So also, again, starting with the foundation, what is a vaccine? So a vaccine basically is a way to teach your body how to fight an illness without you having to get the illness. So anytime you get sick with some sort of infection, your body will create antibodies to that, right? So it sees something in the body that is foreign, that is not of you, and it will make antibodies against it, and it will train these infection fighting cells to, if it ever sees it again, to recognize that pathogen, okay, that foreign object, and to immediately kill it. So what a vaccine is doing is trying to expose your body to what that virus looks like without you having to actually get the virus, right? It's the safest way to build immunity. Like, you don't have to go through it in order to be able to fight it. What makes this, I think, so controversial is that it's an mRNA vaccine, and people have been really up in arms about that because we hadn't heard about that. And if you're not deep in, research, you shouldn't have heard about it, right? But it's not new. So I'm going to share with you an illustration just because I think it's the best way to sort of explain what mRNA is. First, let me share this slide with you, okay? I want to point out that this is not the first mRNA vaccine, right? That is something that people have said over and over again, and I want to debunk that. This is actually not the first mRNA vaccine that was ever developed. It's not the first mRNA vaccine that was studied in humans. So people are saying, oh, they're using us as guinea pigs. This has actually been studied before. Think about it, though. There hasn't been a widespread infectious disease that would necessitate using this technology. So this technology has been on the shelf. It just so happens that now we have this illness that has spread all across the world. Everybody's impacted. Now we have an opportunity to use this technology that we had in our back pockets. So what is mRNA exactly? I'm going to show this to you. So a lot of people will say, oh, these vaccines can mess with your DNA. And I want to show you why that doesn't happen. So this is a cell, right? This is the nucleus of the cell. And this is the basic makeup of every cell in your body. In your nucleus is your DNA. If you think about it, DNA is like the blueprint of who you are, what you're going to look like, how your cells are going to function. DNA never leaves the nucleus. I don't care what kind of cell it is or who you are, your DNA does not leave the nucleus. It always stays in there. But if you think about it, if you're an architect and you make a blueprint, you don't actually build the house. A contractor has to build the house, right? So you've got to get the blueprint, the instructions to the contractor. That's what RNA does. And specifically mRNA, that M stands for messenger. It's a messenger. It sends a message from the DNA out to the cytoplasm. That's the outside part of the cell. to this ribosome. That's something that makes proteins. And that is how it makes a protein that looks like COVID, that looks like the outside of COVID. And your body will use that to start making antibodies against it, right? So once your cell makes that protein, it will put it out on the outside of its cell. And one of those infection fighting cells that's always floating around is going to see that and go, what is that? That's not of us. That's not supposed to be here, and immediately go and kill it. The other thing that's really important to know about mRNA, messenger RNA, which is in your body right now, is that it is always temporary. Okay, so messenger RNA is very similar to Snapchat or like an Instagram story, right? It's designed to give a message, and once the message is read, once the ribosome has traveled down the mRNA and read the message, the mRNA is degraded. So it does not stay in your body. So once you've had this vaccine is going to give you the message for how to make a protein that sits on the outside of COVID. Once it gives your body the message, it disintegrates and it's no longer in your body. So that's a quick, maybe not so quick, but that's the foundation that I think we need as we go into this conversation. And I want to make sure we all start with that same basic knowledge.
Thank you, Dr. Kennedy. So we'll go and move to Dr. Dawson. Dr. Dawson, so statistics show that 1 in 5 African Americans have been vaccinated here in the state of Alabama. So what does that mean for the state?
Well, instead of speaking about the state, I want to speak about the people in the state, because the truth is that when you begin to look at this virus, and you say that there's 1 in 5, that means that, okay, if 5 of you get on an elevator or sitting in a room, that means that only 1 person been vaccinated. So that means the other 4 individuals are at risk of exposure. So let's say that out of that 4, 1 person has COVID but has no symptoms. And they're sitting there just talking to you, you know, laughing, having a great time with you. Well, guess what? They're probably spreading COVID at that time. And so that means that now out of those 4 individuals, 1 person could end up infecting 1 other person, 2 of them, you know, or all 3 of them. And so then you have 3 people now that have COVID. If they end up not having symptoms and they go around and each one of them go around another, you know, 4 individuals, that infection can begin to spread. And one of the things people have to be aware of is that Alabama now, like many other southern states, are not reporting data on a daily basis about who is catching COVID. So we don't have that up-to-date statistic the way we had when the pandemic was early and it was widespread. So without that information, it also places you at risk. And the other thing that we also have to remember is that as a country now, we have surpassed 500 million. We're at 604 million individuals now that have this virus. And so with the country relaxing some of the restrictions, as well as the fact now, we're not testing the way we were testing early on. So again, without testing, we don't know whether people, you know, have the virus or not. And again, like I said, some people are going to have symptoms and other people are not going to have symptoms. So you have to begin to think about protecting yourself. And so this is information that you as an individual, and if you're a parent, you have to begin to monitor that. Because I can tell you, I know individuals that have been in their 70s that have died from COVID, some in their 30s or early 40s, and also high schoolers. And so this is not, let's wait and see and take a chance. And I know at this time we're kind of like outdoors and doing a few things, and we're not as closed in as we are during the fall and winter months. But yet still you have to look at how we're conjugated and the number of individuals that are now back out in restaurants and on the beaches and at the park, and the close proximity. When I look at the news, I don't see social distancing anymore. I see people in crowds. I see people sitting out across the table from each other, laughing and talking. So we have to be concerned and careful about whether or not we're going to get into another spike later in the summer or early fall or winter next year. So we can't just be relaxed and say, oh, we have conquered this. We have not.
Thank you so much, Dr. Dawson. Dr. Kennedy, let's talk more about the vaccine. So we know that there are 3 vaccines that we have. Can you tell us a little bit about each of the vaccines?
Absolutely. So we have 3 vaccines that have been approved for use here in the U.S. There's Pfizer, there's Moderna, and there's Johnson & Johnson. Now, Pfizer and Moderna are both mRNA vaccines, like we just talked about. Johnson & Johnson is called an adenovirus vaccine. So it functions a little bit differently. The way that Pfizer and Moderna gives you the message for how to make that spike protein that sits on the outside of COVID, adenovirus, what they've done, so let me back up. Adenovirus is also a virus that causes a common cold. And the reason they like to use it in the lab is that it's very easy to modify. So its DNA is very simple to understand, and it's easy to lay it out and to modify it as you want to. So what they've done is they have modified the adenovirus DNA to include a segment that codes for the messenger RNA. So it's basically the same process. It's still mRNA. It's just an extra step before you get the mRNA into your body. The adenovirus will go into your cell and it will create the messenger RNA as opposed to just giving you the messenger RNA. So the differences between them, Pfizer and Moderna were both created really pre-variant. So that's one thing that I think we have to keep in mind. And I'm saying that intentionally because it'll make sense in a minute. Those were created pre-variant, and those are vaccines that require 2 doses, right? So you get your first dose, it's the first exposure that your body gets to it. And then a month later, you basically get a second, almost like a booster dose to make sure your body was paying attention to the first one and that it's gonna mount a really robust response. Johnson & Johnson is just 1 dose, right? They give you 1 time, and then your body will, build its immune response based off of that exposure. Johnson & Johnson has a lower efficacy. It's in the 60 to 70% range. There are a couple things that we need to keep in mind though. Like number 1, Johnson & Johnson was created during the period of variants. So that may impact its efficacy. It may not, that may be the reason why its efficacy is not as high as Pfizer and Moderna's, which are 95 and 94% effectiveness, respectively. The other thing about the Johnson & Johnson, not only was it tested during the time that variants were spreading, which could impact its efficacy, but also it's 1 dose. So if you only had 1 dose of Pfizer, you don't get up to 95%. If you only have 1 dose of Moderna, you don't get up to 95%. So that's the difference between those vaccines. If Johnson & Johnson chose to give a second dose, and they are testing to see what that looks like, their efficacy, I bet, will be much higher as well. And then the last thing that I'll point out in the differences between the 2 is that Johnson & Johnson, they had a very, very robust study. And I will tell you, I've been through all 3 of the studies and all of their data. Johnson & Johnson was done across multiple continents. They had lots of people with comorbidities. I mean, you name it, lupus, sickle cell, renal transplants. If there's some sort of illness, they tested somebody with it. And so I think that is a strength to that vaccine. And that's part of the reason why, plus the fact that it's just 1 dose. And for some people, 1 dose is more appealing to them than having to have 2 doses, or that works better for their lives. That is why I think they approved the Johnson & Johnson. They wanted that kind of variety in the offerings of vaccines here.
So speaking of Johnson & Johnson, we've heard some things in the news about Johnson & Johnson over the past, month or 2. I mean, is it safe to get?
Yeah, so Johnson & Johnson is safe. It was first of all, this study involved lots and lots of people. And that's what you want with a study, right? You want them to test a lot of people, because hopefully if they test enough people, then they can, first of all, there's going to be somebody in that crowd that is like you, that's your age, that, you know, has the same illnesses that you have, they're the same race as you, you know, if they did okay, the odds are you'll probably do okay, right? But Johnson & Johnson did have 6 cases of this very unique type of blood clot that happens in the brain. Couple caveats. It was 6 people out of millions. At the time that they paused it, there were 6 million doses that had been given, and 6 people had had these clots. The other thing that we have to keep in mind is that COVID itself, the infection itself, causes blood clots. So it's not like the vaccine caused something that the illness does not. I mean, if you get COVID, you are also at risk of developing these clots as well. And then the last thing, and the reason why they had to pause and try to take a look at it, is we have to separate out causation and correlation, right? So the example I'll give my patients is I could eat a peanut butter and jelly sandwich and walk outside and get hit by a bus. That doesn't mean the peanut butter and jelly sandwich caused me to get hit by a bus. So you don't know for sure that this thing caused that thing. It's the same thing when you hear about people that got the vaccine and then a few weeks later they died. Well, they have to actually analyze those cases to figure out, was there causation? Because people die, right? Like those people, it's entirely possible that they were going to die anyway. None of us knows, you know, the day or time, right? It could be entirely coincidental that they got the vaccine a couple weeks before their time was coming, no matter what. So that was what they paused giving out the vaccine while they could do those analyses to figure out, was there causation? And after they did the analysis, they did not find that there was enough linkage to warrant not continuing to give the shot. Because remember, there were 6 people that had these clots, but that meant that there were 5,999,994 people who got the shot and did not get clots. And so that's how they made the decision that it was okay to continue to give it.
So we have a question in the chat. People are asking, do we have to have a booster, whether it be for J&J or whether it be for any of the other shots? What are they talking about in regards to booster shots?
So we don't know yet. We know how these vaccines work. We know that they're effective, but the only way that you're going to know how long it lasts is to watch it, right? Like that's the part that they're still studying. And so it's important to note that the Pfizer, Moderna, and Johnson & Johnson studies are not over. So part of their study design was that after the second dose was given, they were going to continue to track all participants for a minimum of 2 years after their second dose. So those people that were in the study are still being studied. So it's not like a one and done, and if people are falling out and dying, nobody knows. No, they are still tracking those people to see how they're doing. They're still tracking those people to see if they get pregnant. They're still tracking those people to see if they have clots or side effects. They are also tracking them to see how long they continue to have their immunity. It is possible that we may have to have a booster shot, but that is not new. If you think about it, tetanus boosters, right? You get your tetanus shot, it will last you for a long time, but eventually you have to get a re-up. You've got to get another shot. When you get pregnant, they make you get another MMR vaccine, right? Like, again, for all of the vaccines that exist, all of them are a little bit different. And some of them will give you immunity for the rest of your life, but most of them will eventually require some sort of booster. It's just a question of how long can we go before we need a booster shot.
Dr. Dawson or Dr. Kennedy. So I've had someone say this to me, and I've had actually several people say this to me several times, that, hey, I'm covered by the blood. I don't need a vaccine. I'm good. So what are you all's thoughts on that?
I think everyone have to again step back and make sure from a spiritual standpoint that they are interpreting the scripture correctly. And yes, we may be also covered by the blood, but I want to remind people that even Jesus had a physician on his team. Okay, so interacting and relying on both science and spirituality, but more importantly is listening to information and making common sense decisions as well. Because one of the things we know, just like when someone said, well, do we have to have a booster? Okay, we have to step back and we have to say, we only started giving this vaccine back in December. So do we know whether we're going to have a booster or not? Not quite. As Dr. Kennedy just said, and that is because the research is still going forward and still emerging. But what I will say to people is that, some people say, well, I'm not going to take the vaccine. I'm just going to wait and get COVID. Now, to me, that is a big gamble, knowing what COVID can do to your body. And you don't know whether you're going to be one of those individuals that may end up being okay, or if you may end up being one of those individuals that end up and that costs you your life. I know a lot of people are also saying, but if I get COVID, then I'm already protected. Not necessarily so. We know that our own Coach Saban down there at UA, he's had COVID twice. There have been other people that have had it more than once. And the thing that I would say to people is that you have to step back and you have to begin to listen to what information is clear to you and what information is just basically incorrect information. And we call that disinformation. Somebody putting out something that is false and you're following behind it. So this is not a time that you need to depend on your non-medical friends, your Facebook pals, and Instagram conversation and chats. This is just not safe for you to do that. And you don't want to do it. So as we continue to move in this space that we're in, yes, we're going to continue to learn. But one of the things I also want people to understand is because this is a relatively new disease, we don't know what's going to be the long-term effect. And I was so glad when CDC and the news media stopped using the terminology, the number of individuals that had recovered from COVID. Because from my perspective, no one have recovered from COVID. They don't have the symptoms anymore. But as we're now learning and we're hearing about what they call long hauler symptoms or long hauler disease, that just means that now that people that have had COVID, there are certain things that they're noticing occurring in their body and they don't know what else to contribute it to at this time. So they end up saying that it must be related to COVID. And again, some people, even when they go to their primary care physician, are looking at these patients and saying, we don't know what else it might be other than maybe contributed to that. So you don't want to take a risk with your health going forward, especially when we're in a space that is unknown. And this is unknown territory, but thank goodness for the scientists, they come up with something that can help us with that. And we just have to be wise enough to step up and say, yes, I'm going to take it. I mean, I took my 2 shots. And did I have some symptoms prior to? Have I had some symptoms afterward? Yes. Now, I could just say that may just be due to age. I can't blame everything on COVID just because I had a vaccine. I've not had COVID, and I didn't want to risk catching COVID. So for me, the vaccine was a much safer and a much better option, even though I feel that I am covered by the blood.
Thank you, Dr. So, Dr. Kennedy, we have a question in the chat that asks, could you talk about the safety of the vaccine, especially for children? And then which one do you feel is the safest?
So the safety profile for the vaccines, it is similar for children as it is for adults. And in fact, I dare say, it might actually, kids did even better. In adults, the symptoms with the vaccine were very mild. It was fever, it was some myalgias, there was pain at the site. Some people, especially with the Moderna vaccine, would get swelling at the site of the injection. But all of this stuff was pretty short-lived. If you look at the data from children, they tended to not even develop many of those symptoms. The thing that's important to note is that they structured the studies the same. So they used the same rigor with the studies for children as they did on the studies for the adults. And so there were no corners being cut for the children. In fact, I think they were able to be even a little more robust going into the studies of the children, because we already had all of this, all of the studies that had been done on adults and the structure to kind of build off of. So I would not, my children are too young at this point to get the vaccine. No, I take that back. My big kids are old enough. They're technically adults. They have both been vaccinated. But, and for each one of the vaccines, I have personally reviewed all of the study data. And as a kind of part-time researcher, that is something that was up my alley and easy for me to do. I will do the same thing when that data comes out for children that are younger than 12. And if it looks just as good, I will vaccinate my younger children as well. Yes, you can.
Is one of the vaccines safer than the other vaccine?
Nope, all three have been shown to be safe. So none have a greater risk profile at this point than the others. I think the only hiccup was the clot formation with Johnson & Johnson, which they have acknowledged is a real risk. They have not seen that in Pfizer and in the Moderna vaccines, but the prevalence of it was so low. I think that's part of the reason why, in my mind, when I look at that data, it's sort of a wash. I would say their safety profiles are fairly similar, because while it is a side effect that is scary, it is very, very rare when you look at the numbers.
So there's another question that says, which one did you use? And I'm assuming it's saying the vaccine.
I got Pfizer. That's what UAB was offering. My mom got Moderna. My husband got Pfizer. And my two kids, I think they both ended up getting Pfizer. So.
Yeah, I had Pfizer as well, because actually I got mine prior to Johnson & Johnson coming on the market.
So another question, Dr. Dawson, since you are already in front, what about healthcare workers? Are they taking care of themselves?
I think that's the other thing as well. You know, during this pandemic, we've heard people refer to healthcare workers and especially nurses as frontline heroes and frontline warriors and those type of things. But guess what? These are people just like you are. I mean, they have family members, and so they can get physically tired just like everyone else. And so again, when the public protect themselves, they're also protecting the nurses who they expect to be available to care for them. And yes, nurses are not only just physically exhausted, the same as other healthcare professionals, because even though I'm speaking about nurses, they don't work in silos. There are respiratory therapists that was out there. There are anesthesiologists and nurse anesthetists, the ER physician, the ICU physician, you know, all these individuals that work as a team to ensure that patient receive the best care that they can receive. Every time there was a COVID patient, they were putting themselves at risk. And many people may not know this, but you know, there's been over 2,000 and some deaths of just healthcare workers, you know. And unfortunately, when they started collecting the data early in this pandemic, they weren't breaking the data down to the granular level, that low level where they can say how many was nurses, how many was respiratory therapists, and those type of things. But we do know that even for nurses, there's been quite a few of our colleagues that have passed, or quite a few of our colleagues that have also caught COVID while they were taking care of patients. And so this is important, is that if you want your healthcare workers and providers to be here for you tomorrow, then you need to help us take care of them today. Because this is, you know, I will say, unfortunately, and people probably wasn't thinking this when they were saying it, when they say that these are frontline workers, it's like being in a war zone. It really is, because many of these nurses are going to have post-traumatic stress syndrome. They're already under a lot of more distress. You know, when I have a young nurse say to me is that, I'm just thinking about getting out of the profession because I've seen 10 patients die in the last 7 days and I can't take this anymore. You have to realize that is serious and it's true. So, and again, during the time that this pandemic was really just elevated in places like New York and Miami and California, not only did you have nurses that were staying in a hotel to keep from carrying this virus home to their family, But again, they were sometime the last person and the only person that that dying patient saw. And they end up not just being the nurse, but they were the chaplain, they were the family member. So they were trying to fill the gap for all of those other social contacts that most of us expect when we're at the end of our life. And that couldn't happen. So that fell back on the nurse to do that a lot of time. So again, we have to look at this through the lens of, I am my brother keeper. And if that is the case, then I need to do my part and fight in this as well.
Thank you, Dr. Dawson. So we have another question, Dr. Kennedy. So are there any benefits of having the vaccine?
I mean, other than not catching COVID? I mean, are we wondering if it gives you any other, like?
I would say peace of mind. That's one, because again, no one is walking around, and I'm one of those strange people. I've had my vaccine. Yes, I'm still wearing my mask. But I don't see anyone walking around with any sign on their forehead, on their back or chest saying, I've been vaccinated. So I don't know who have stepped up to the plate and done that. So I think we have to look at it from that perspective, is that, yeah, it's good to be able to have that peace of mind. And it's also good to be able to, again, feel that you're doing this not just for yourself, but for your family and for mankind.
So are there any, or is there anything that we can do to prevent ourselves from catching COVID-19?
Yes, so there's plenty that we can do. I mean, number one, now that we have the vaccine, is people can get vaccinated, right? A virus, just like any other virus, like it cannot live on its own. It needs a host if it's going to continue to live, right? If it's going to continue to survive and to spread. You can have a vaccine on a surface, like you can cough onto a doorknob or onto a computer mouse or whatever, and it'll live for a few hours, but eventually it dies off. If it wants to continue to live and divide and grow, it needs to be in a host. And the more people that are vaccinated, every time it gets to one of us that are vaccinated, it can't continue to grow because we have enough antibodies to kill it off immediately. If you think about it, it's like, if you have two armies coming onto a battlefield to fight and one's got 10 soldiers and one's got 10,000, who's going to win, right? If you've already got this massive bank of antibodies, when you get exposed to the virus, it doesn't have time to divide because your antibodies will jump all over it immediately. I say all that to explain the fact that if more people are sort of stocked up with antibodies and able to kill it off immediately, the virus cannot continue to spread, right? So that's the first thing. Like the more people that get vaccinated, the more people that are protected, the less you're going to see it spreading. The second thing is we know for a fact that masks work. Now, there are a lot of people that will tell you masks are just theater. It doesn't really work. I will tell you, as someone who takes care of COVID patients to this day, masks absolutely work. And not just N95 masks, a well-fitting mask works. And not that they have to be medical grade masks. I mean, we have had incidents where we've had people, healthcare workers that have been asymptomatic with COVID at the time, sitting in our workspaces, not wearing medical grade masks, because we can wear cloth masks when we're not out in the patient care area. So we come into work with our cloth masks on, and then we change into our other masks when we get ready to go out onto the floor. And those people did not spread it to everybody else in the office because they had their cloth mask on. Okay, so that's the first thing people say is, oh, but you got different masks in the hospital. Only when we're out on the floor, though. But otherwise, we have been able to keep this from spreading across all of our workers. The other thing is I see people saying masks don't work, but you're not wearing it right. You got your nose out and the mask is down here. You got the mask down here on your chin. You got the mask on your arm. You don't get credit for carrying the mask with you. It only works if you have it on and if you have it on right, if you have it over your nose and mouth. And then the last thing, of course, is just, good hand hygiene, just good hygiene in general. keeping some space from people. If you don't have a mask on and you cough, you want to make sure you're covering that, coughing into your elbow or into your crease, just like I teach my kids. Or if people are sneezing, same thing. It's those simple, hygiene sort of prevention measures that can keep you from catching COVID.
Dr. Dawson, did you want to speak to that? I saw you.
I would just tell people, don't stop good practices that we should have been doing anyway. So the things like the hand washing, again, coughing into your elbow or your arm, covering your mouth when you sneeze. These are things that our parents taught us as young children anyway. We should have never gotten away from those type of things. So, and no sense in us having restarted doing the right thing, and then we become so comfortable we think we don't need to be washing our hands, but we just need to do that anyway. So I think it's extremely important that we all have that, again, responsibility of cleanliness. I just think that you need to be able to make sure, again, that you're paying attention to how you're interacting when you're out in public. I don't want somebody walking up in my face coughing or sneezing. I want people to continue to wash their hands and use hand sanitizer. And to be honest with you, I was using it before the pandemic. I already had my big jar in my trunk. So it wasn't something that was unusual for me. And I had my little small one, right in the little pocket of my car on my door. So there are certain things we should be doing anyway that we don't have to say we started doing it because of COVID. If we did start doing it because of COVID, let's not stop it. Let's just continue those safe hygiene methods.
Thank you. We have a few more questions in the chat. So Dr. Kennedy, can vaccinated people still transmit or spread COVID?
So it is still possible. So remember, even with, Pfizer and Moderna, which have the highest efficacy rates, they're not 100%. So if Pfizer has a 95% efficacy rate, that meant that 5% of people still managed to get COVID. Now, what's important in that is that none of those people died, right? So even though the 5%, even though they ended up catching COVID, they did not get COVID with the same severity as those that are unvaccinated. But that means that in that 5 to 6% that could potentially still catch COVID, they can still get the infection, which means that they can be spreading it to people when they're out and about, which is another reason why, Dr. Dawson, I actually don't think that it's odd that you still wear your mask. I still wear my mask too. I don't know if I'm going to be a part of that 5 or 6%. I could still catch it somehow and spread it to someone else. So yeah, it's not 100%, but that is not a failure of the COVID vaccine. None of the vaccines are 100%.
So once and I think Dr. Dawson also spoke to this, but once you have COVID, can you get it again?
Yeah, so you can. So once you have COVID, we do know that you have what I like to call short-term natural immunity. So you will have immunity from COVID because you got all these antibodies ramped up and floating around. And what we found is that typically lasts about 90 days, so 3 months. And we know this because we've been following people since the start of the pandemic, right? There are researchers that are following people that get sick with COVID. But after about the 90-day mark, the antibody levels start to really drop off. And when the antibody levels get low enough, remember our analogy about being on the battlefield, you don't have as many soldiers up in arms ready to go if you get exposed to COVID again, which is why you can get reinfected. Just like Dr. Dawson mentioned, Nick Saban is a great example of that. He had COVID, went for a while, caught it again. So you can get it again. And that's why there are a lot of people that are walking around saying, well, I don't need to get vaccinated because I had COVID. That immunity is only going to last you for a few months. Mm-hmm. And then you are open and susceptible just like everybody else.
And then we also need to learn from other countries and other societies. China started going down and then they had a resurgence of it. Now we look at Tokyo over in Japan. The same thing happened to the extent that they canceled the Olympics again, this year. And so we just have to know that the US is no different. So we can either continue to do the right thing and continue to see the numbers drop. But if we become careless and overly confident that we have this under control, I think letting our guards down like that will put us at greater risk. Because I think what Dr. Kennedy has said repeatedly, and I'm just going to break it down to the lowest level I can get it. The virus is real, but not only is it real, it is a living organism looking to survive. So just like we're trying to protect ourselves and say, I don't want you and me to survive, they're going around just tapping people on the shoulder. So they're saying, oh, this is a good host. This is where I'm going to sleep tonight, okay? Because there's no protection there. You're out in the elements, in other words. So it's just like if I went out in my yard, no protection, and it's mosquito season, they're going to bite. That's just it. And that's the same thing with COVID. If they find a host and that host is not protected, they're saying, oh, this is a nice place for me to come in and make my home. And once it's there, because it feels safe, it just began to multiply. So we have to make sure that we are not the one that providing a hotel for this virus.
So we have actually another question from the chat, and someone asked, so how can we help get people or more people vaccinated?
I would say have the conversation. I mean, I had to have the conversation with my family members, and I was one of the first to get vaccinated. So I stepped up to the plate, and then my sister was next, and my sister was really funny because she was trying to get vaccinated, and she thought she was going to get hers at UAB, and she couldn't. And so finally she found somewhere else to go, and she started telling, that was still when you had to call in and make an appointment. And so she started telling my cousins and others and some of her friends, and they end up getting vaccination prior to her because they got earlier appointment. She said, I'm out here helping other people and they're going ahead of me. But she finally got to that point where she really wanted it. She was comfortable with it. And she's a lot older than I am. But I would just say, make this a family affair. It's kind of like what I just heard Dr. Kennedy say about her older kids have had it. She's had it, her family, her husband had it. If something comes out for the younger kids, she's going to also allow them to be vaccinated. So you listen to people who are not asking you to do something that we have not done, and since this is the way I feel that the vaccine is much safer than COVID. Out of all the people that have been vaccinated, there have been very, very few deaths, and just like Dr. Kennedy said, we're still studying those cases because we don't know whether it was caused by COVID or something else, and so it's important for people to understand. But when I sit here and tell you that how many 604,000 some people have died from this one virus, and at one point it was the number one cause of death in the United States. Those are just not odds you want to gamble with.
Thank you, Dr. Dawson. Are there, let's see, I have one other question so far, I believe. Are there any long-term effects from receiving the vaccine?
So we don't know, right? Because it hasn't been around long enough for us to be able to speak to that. But what we know and understand about mRNA, it seems unlikely because it's not something that actually lingers in your body. It literally comes in and teaches your body to make a protein, and then it gets broken down and it's gone. There's no remnant of it anymore. If someone checks your bloodstream, they can't get a trace of the actual vaccine. All they get are the antibodies that your body has since made, your natural response to it. So I have a hard time thinking of what that long-term side effect could be. Time is going to tell, though. I mean, we'll have to wait and see. But that's why it's so important to understand the science behind how it works. And I think part of the reason why UAB started asking me to speak to the community about the vaccine on behalf of UAB, and especially to just for some of the community outreach events that they had, was because I initially was not going to get vaccinated. And not because I was, not because I believed any of the conspiracy theories or anything like that, but I am very much a purist. I'm a minimalist. I don't take medicines unless I don't have to. Like my plan was not to get vaccinated. And at that point, I felt like I had made it 9 months taking care of COVID patients, like in the thick of it, and had not gotten sick. I felt like I knew what to do. I knew how to wear my mask, and I knew, I wasn't going to go out, and I didn't think that I needed to put anything extraneous into my body. But then I actually sat through the FDA presentation that Pfizer did on December 10th. It was 2.5 hours, and I sat and I watched the whole thing, and I looked at the data as they presented it, and then later I read it myself. And then a couple weeks later, when Moderna did theirs, I did the same thing. I went through their data, and after going through all of the data and understanding the science, and then doing some research on mRNA vaccines. So when did this all start? When did they first come up with this? And that's when I learned that, okay, this is not new technology. This has been around since the 1980s. This is not the first mRNA vaccine that's ever been developed. All this stuff that you were hearing, it's like none of this stuff is true. And this is me doing my own research. And this is me going to PubMed and reading journal articles, peer-reviewed journal articles, not reading off somebody's Facebook post. And it was after that I decided I was going to get vaccinated. And they decided that that was a worthwhile story to tell. And so I share that with people. Like, if you're someone that likes to do things naturally and that doesn't like to take medications, I'm the same way. But I was convinced after I read the studies myself that these were very strong studies. This was done very well. The science behind the vaccine is very robust. It is well established. It is not new. And to me, it didn't make sense not to get the vaccine once I fully understood it.
And actually, Leslie, there's a couple of things that just kind of is fresh in my mind, and that is when we had the flu epidemic here in the United States. And I can remember back in 98 or so, we actually was one of the first hospitals. I was living in Kentucky at that time, working at the University of Louisville, one of the first hospitals in the United States that used drive-through, giving drive-through flu shots. And actually, so most of the work that people were doing when they started doing drive-through testing and drive-through COVID shots really was used off a manual that we produced, and CDC picked that up. But also, as I think and I listen, no, we don't know because this is so soon. But when I talk to people that have had COVID, when I hear some of them talk about how tired they are and that they can go to work and at the end of the day, all they want to do is come home and just go to bed. Or I listen to that nurse that says, yes, I had COVID, and now it seems that every 3 months or so, I'm getting a rash, and each time it is painful. It's in a different location on my body, so no, it's not the shingles. My primary care physician has said that's not it, but it's on my leg at one time, the next time it's my arm, the next time it may be my back. So we are learning about this, and that's the other reason why you don't want to really expose yourself to it, because it is so new and we are just discovering things. So again, we have to say, I'm not going to be taking a risk. Now, if you're one of those individuals that are going to stay at home, you're going to do your own contact tracing. And I laugh because I told someone, I said, when the school told me that I could just work from home, I told someone, I said, trust me, I was at home. I came up with my own schedule. I would go out and I would shop either once or twice a month. I would go to 2 or 3 places, and I made sure I wrote down exactly where I went. That way, if I came up with COVID, I didn't have to go everywhere else looking. I can say these are the location where I was at that time. So I was trying to be very careful not to catch it. And so again, that's when the vaccine came available. I was more than willing to take it. But the other thing is too, I've been talking about this and educated on it from a national perspective for so long. I started really in March as soon as it came out, because again, I started learning about the science and started reading things and started participating at the national level. I even had a chance to interview a couple of the scientists when they was early in the process with Pfizer, who was in the lab, trying to come up with the vaccine. And I had conversation with them, and I was asking them some of the critical questions and things that I felt I needed to have answer to in order for me to be able to address those. And many of our members, we had several of them that were sitting on some of the CDC and some of the other advisory council, also learning about this as they were going. Worked a lot with the Ad Council in terms of saying, what type of messages do we need to put out there and who need to be the messengers around helping our population understand more about what is going on. So I think all of those things are important. But again, just like Dr. Kennedy, there's been many other physicians that I've shared a platform with. So we are fortunate that we don't have enough of Black nurses nor Black physicians, trust me. But we are fortunate that we do have people in the space that we can talk to and have some conversation with.
Thank you. Dr. Dawson, Dr. Kennedy, I apologize. So will you explain why people have flu-like symptoms after receiving the COVID shot? And they say that this is kind of a two-part question. And is it good to take Tylenol before you get the shot? Because it seems like these symptoms are causing lots of people not to take the shot because of the symptoms after they receive it.
Yeah, so that's a really good question. So the reason you get symptoms after the second shot is because the first shot worked. And so I'll explain what that means. So when you get your first shot, if you're someone that's never been exposed to COVID, that is your body's first time ever seeing this spike protein. And so it will first of all take a picture of it, right? And it's going to start building antibodies against it. So it'll know how to kill it. And we also know that these vaccines not only cause antibody production, but it also causes your body to train up those infection fighting cells also. So you get kind of two types of immunity, both the antibody driven immunity and cell driven immunity, when you get exposed to it again. So the second time you get your shot, right, your body has seen it before. And so your body immediately starts to rev up, because remember, your body can't tell initially if this is the vaccine or if this is actually COVID. Like, is it go time? Like, are we seeing it for real for the first time? And so your body starts to react to try to kill it. So you will start to have fever. If you think about it, whenever you get sick, yes, it's the infection causing fever, but it's actually your body that's causing the fever. Your body is trying to kill it off. It's trying to raise your body temperature to be able to kill whatever bacteria or virus is there. And that makes a ton of sense. What do you do with baby bottles in the nipples? To clean them, you boil them, right? You raise the temperature. That kills off the pathogens. When you cook food, you get the temperature high enough, you kill off stuff. That's what your body's trying to do, is trying to raise the temperature. It will do other things to try to raise the temperature. It'll make you shake, right? You'll get the shakes. If you're out at a football game and it's cold, you start to shiver. Why? Because your body knows that if it can make you move, movement will create heat, and heat will cause the body temperature to go up. So all of these are normal responses to try to get you to kill off what it believes is the virus. After about 24 hours, your body will realize it's a false alarm. It was just the second dose of the vaccine. It's not the real thing, and the symptoms go away. So I remember when I got my first shot, I had no symptoms whatsoever. I was a little sore on my arm. I didn't feel a thing. And then when I was going for my second shot, I actually told the nurse, I hope I have symptoms because I want to know it's working. And I did. Then I was sorry because I had fever up to like 103 and I felt like crap, but it only lasted for 24 hours. I personally waited to see if I was going to have symptoms before I took medications, but I'm also a person that doesn't like to take medicines. Once I started to have the symptoms,
to me, I didn't have a fever. I didn't have any of that. And so I say that because someone may end up taking the vaccine and they don't experience those things. So don't say, well, I didn't get all of that, so maybe something is wrong with me. We all respond to medications and differently, and our bodies are going to respond differently. So I just wanted to put out there that I had a totally different experience than others had a totally different experience as well. And some people I've heard say, well, it's due to age if you're older. because your immune system is already decreasing. Some you don't respond as strongly as other. And I don't know that there's any truth to that. I know my sister, she was teasing. She said, well, you mustn't have the right thing. Then when she got her second one, she had no problem either. But then with my nephew, who's in his 40s, it was like he was in bed for about a day and a half, So all of us are going to do something slightly different. So that shouldn't stop us still from making the right decision.
No, that's a good point. Every body is different. And I will say they've also found that to that same point, it's more common for women, for example, to have those side effects after the second dose than it is for men. We don't totally understand why, our bodies are different though, right?
Mm-hmm.
So men, even though they're not having the symptoms as often after the second dose, they're not finding that those men have lower immunity than women as they're studying people. So that speaks to Dr. Dawson's point, is that just because the men didn't necessarily have the same symptoms doesn't mean that it didn't work. It's working just as well in them.
Well, we're actually over our hour. I want to thank both Dr. Dawson, Martha Dawson, president of the National Black Nurses Association, as well as Dr. Kennedy, Kirsten Kennedy, who is the chief of UAB Hospital Medicine, as well as our partners, the Church of New Life Interfaith Ministry, as well as our Counselor Donald, as well as Counselor Alexander, for providing this opportunity. We've had great questions. I really appreciate you all for this. And hopefully if we can answer some of the questions, please, for those who are listening, email me and I will make sure that I get these questions answered to either Dr. Dawson and Dr. Kennedy. And my email is lmharris, which is HARRIS, at Samford, SAMFORD.edu. And thank you all again. Have a good night.
Okay.